head, going into a little bit of classic capital extension. Okay, let's use the terminology, right? He's got a protracted, okay, depressed, medially rotated shoulder girdle. His humeral heads are medially rotated. Okay, so it seems a little longer. Does that correlate with what you all are seeing? Is he sitting symmetrically through both ITs? Okay, so we'll have to look at that once we get him, his feet in contact with the ground. Okay, and I just really quickly look here. Let me ask you to take your shirt off for a second. Okay, and I don't analyze posture typically through skin. I'll try to expose as much as I can appropriately. So I just want to really quickly look. Is the inferior angle of the scapula about T7, T8? Are they level with one another? Is one like really weirdly rotated or anything like that? What's interesting, I do see something that's of significance to me. For as developed as he is in his middle traps, rhomboids, upper traps, what do you see on the medial border of the scapula? You see that winging a little bit? Okay, go ahead and push your arms straight out for me, please. Let's go this one. Okay, go ahead and let me resist you. Okay, so dynamically, that serratus contracts and pulls that scapula right in. Kind of turn you around this way. Let me see. And we'll go on this side. Okay, so you see that winging there? Okay, medial border winging. So medial border winging, inferior angle, that's all serratus. Okay, go ahead and up to 90 degrees, resist. Okay, he protracts, and dynamically he doesn't have a winging. Okay, so I would start to think of there's some sort of disconnect between those middle traps, rhomboids, and serratus, and we'll look at that. Okay, so really quickly, we're just looking at that. So from here, let's lower the table down. Let me know when your feet are in contact with the ground. No, okay. So I want them to get into about a 90-90 seated position. This is just how I do my posture assessment. So whether they're in a chair, they're seated on the side of the table, I know he's got good femur support. I can look really quickly. Is he sitting symmetrically through both ITs? Looks to be about that. Pelvis heights look about level. Shoulder heights, right, so slightly lower than the left. Are you right-handed? Mm-hmm. Okay, so that correlates with that. I don't see anything that really jumps out at me that's concerning and that changed much between an unstable surface and now getting his feet in contact with the floor. So those are just the quick things that I look at. Any questions about those? Okay, good. Okay, so active range of motion. Now this is where I'll have someone sit up straight for me, bring those shoulders back, okay, and then flexion and extension. So let's look up towards the ceiling first. Okay, back down to midline. Flexion, okay. One more time into extension. Okay, so what am I concerned? Quality and quantity, right? He's got good quantity of motion. I'm concerned because he's got a hinge which looks to be about C6. C5, C6. One more time into extension. Any pain with that at all? Okay, so he stops extending. Go ahead, come on back, stop. Okay, right there is the limit of his cervical extension. From there, it's all upper cervical and he's compensating to get his nose up parallel with the horizon. Okay, and then flexion looked pretty good, although he is kind of cheating, rolling his chin in a little bit. But that could just be muscle limitations there too.
Would you consider that second line that he shows, like he has like 2 hinges? So I don't know if...
That could be 2 different levels that are affected. It could be that he's hinging so bad right there that he's really compensating at that, you know, so if that's C5, at C4 and C3, he's really working to get that nose up to the horizon to get that neck fully extended. Okay, and then right and left rotation. Okay, right and left side bending. Okay, so what sort of pattern is he presenting with? Opening or closing? Restriction. Closing, why? Okay, because it's extension, it's side bending, and rotation are all limited. Okay, so that, and because he's more limited just from that and extension, that's my primary hypothesis. Okay, let's just, yeah.
Could you show us where the hinge is?
Yep, can you turn around this side? You guys all saw that okay? The hinge? Okay, go ahead and extend. So if you see where that skin bulges up, that's a hinge. And you can see it too if I go ahead and extend again. Right there. Okay, that's it. And that's just because I'm blocking his vertebrae. That's because from that segment down, he's not moving anymore. It's all that segment up. So it's C2, C3, and then upper cervical that's moving that. Okay. how about getting you in Superman? And the only other thing that I'll look at really quickly is just end feel. So what sort of end feel do you think I'd expect for passive range of motion in the C-spot? Empty? Hopefully not empty. Okay, I'm just looking for tissue stretch. So I'm just gonna bring them into side bending. I can look at rotation, and that just feels like soft tissue resistance to me. You can put them in a little bit of chin tuck and flex them, same thing. And then I can put them into extension. I don't have to bring them into full extension. From there, it just tells me, you know, that the limitation that he's feeling is more myoarticulation. It's more of the restriction that we saw on our active range of motion screen. Okay, so why don't you pair up, do a quick posture assessment,